Dementia is a deterioration in cognitive function in one or more cognitive domains, such as memory loss, visuospatial perception, executive function, language function, etc. Signs and symptoms of dementia depend on the area of the brain that's being affected. In Alzheimer's dementia, the most prominent feature, of course, is memory loss. And definitely most dementia is Alzheimer's, 60 to 80% of it. But there are other forms of dementia where you see people developing problems with visuospatial perception, frontal lobe dysfunction, such as personality changes and behavioral changes, and language dysfunction as well. There are about 5.5 million people with dementia in the United States. The incidence of dementia is about 1 out of every 14 people over 65 and about 1 out of every 6 people over 80. It can be diagnosed in different ways. The vast majority of the time it's a clinical diagnosis, which means it's the judgment of the physician in the context of the symptoms, signs, test results. Okay. The most definitive way to diagnose Alzheimer's disease would be through a brain biopsy, but that's not practical the vast majority of the time. There are radiographic findings on MRI, such as in the case of Alzheimer's disease, temporal parietal atrophy, shrinkage of the brain. The temporal and parietal lobes is prevalent in Alzheimer's disease. There's also PET scanning, which can be performed, which shows hypometabolism in the temporal and parietal lobes in the case of Alzheimer's disease. There are other forms of dementia as well, such as Pick's disease, which has a frontal lobe predominance. There are a handful of medications available by prescription that do help patients a little bit with their memory. But those medications are better at preventing deterioration than they are at improving a patient's existing memory. We recommend that people keep their brain active through doing crosswords, staying mentally active through playing games, interacting with others, and trying to stay current with what's going on in the world and so forth. Just things to keep their brain active. I think the best thing that you can do is to make sure that they are in touch with a board-certified neurologist to make sure that their diagnosis is accurate, their work of a treatment is appropriate. They should have undergone an MRI of the brain and other testing to make sure they actually have Alzheimer's dementia. In terms of treatment, unless there's a contraindication, they should most likely be on one of the medications that are commonly used to treat dementia, such as Aricept or Namenda, and then lifestyle modifications can be helpful as well.